Did you know that as we get older, our hearts can become more sensitive to medications we've taken for years? It's true. Some common drugs, both prescribed and over-the-counter, can put extra strain on our cardiovascular system. That's why today, heart specialists are urging seniors to be more aware of what they're taking. In this video, we're going to dive deep into why this happens and what you can do about it. We'll explore why medication safety is a whole new ballgame after age 60, how certain drugs can impact your heart rhythm and blood pressure, and the critical symptoms you should never ignore. We'll also identify who is at a higher risk and walk you through safe, effective steps to review your medications with your doctor. But first, a very important disclaimer. This video is for educational purposes only. We are not telling you to stop any medication. Always consult your healthcare provider before making any changes to your treatment plan. Your doctor knows your health history and is your best partner in managing your well-being. Now, let's start with the big question. Why does medication safety change so much as we age? After 60, our bodies process substances differently. Our liver and kidneys, which are the body's primary filters, may not work as efficiently as they once did. This means medications can stay in our system longer and at higher concentrations, potentially leading to stronger effects or unexpected side effects. Furthermore, the heart muscle itself changes. It can become stiffer, and the electrical pathways that control our heartbeat can become more sensitive. So, a medication that was perfectly fine in our 40s or 50s might now have a more pronounced effect on our heart rate or blood pressure. This is a natural part of aging, but it's something we need to be mindful of, especially when managing chronic conditions. So, how exactly do some common medications affect heart rhythm and blood pressure? Let's break it down. One major category to watch is non-steroidal anti-inflammatory drugs, or NSAIDs. You probably know them by brand names like ibuprofen and naproxen. While they're great for pain and inflammation, long-term or high-dose use can lead to fluid retention and increased blood pressure. For an aging heart that's already working hard, this extra workload can be a significant strain. It can also interfere with the effectiveness of blood pressure medications, creating a tricky situation. Another area of concern is certain medications for allergies or colds, particularly decongestants. Many of these contain ingredients like pseudoephedrine, which can constrict blood vessels. This action raises blood pressure and can make the heart beat faster or more irregularly. If you already have a heart condition, this can be particularly risky. Even some antidepressants and antipsychotic medications can affect the heart's electrical system, potentially leading to a condition known as QT prolongation. This can increase the risk of a serious arrhythmia. It is a great example of why regular check-ins with your doctor are so crucial. They can monitor for these changes and adjust your treatment as needed. Now let's talk about the symptoms that seniors should never, ever ignore. These could be signs that a medication is affecting your heart. If you experience sudden dizziness, lightheadedness, or feeling like you might faint, that's a red flag. Pay attention to a new or worsening feeling of your heart racing, fluttering, or skipping beats. These are palpitations. Unexplained shortness of breath, especially when lying down or with minimal exertion, is another serious sign. Also, watch for swelling in your legs, ankles, or feet, which could indicate fluid retention or sudden, unexplained weight gain. And of course, any chest pain, pressure, or discomfort should be treated as an emergency. Don't dismiss these symptoms as just getting older, that they could be your body's way of telling you that something is wrong, and it's always better to be safe and get it checked out by a professional. So, who is at a higher risk for these medication-related heart issues? The risk increases if you're taking multiple medications, a situation known as polypharmacy. The more drugs you take, the higher the chance of a negative interaction. People with pre-existing heart conditions, like high blood pressure, coronary artery disease, or a history of heart failure, are naturally more vulnerable. Additionally, individuals with kidney or liver disease are at higher risk because, as we mentioned earlier, their bodies can't clear medications as effectively. Age itself is a risk factor, with those over 75s being particularly susceptible. And if you have a history of falls or dizziness, it's even more important to be cautious, as some heart-related side effects can increase your risk of falling and getting injured. Being aware of these risk factors can help you and your doctor be more proactive. Given all this, what are the safe steps to review your medications with your doctor? This is a key part of protecting your heart. First, schedule a dedicated medication review appointment at least once a year. Don't just tack it onto a visit for a cold. This needs focused time. When you go, bring everything you take. I mean everything: prescription drugs, over-the-counter pills, vitamins, herbal supplements, and even creams or eye drops. The best way to do this is to literally put them all in a bag and bring them with you. This is often called a brown bag review. Be prepared to talk openly with your doctor. Ask specific questions like, do I still need to be on this medication? Or are there any newer, safer alternatives for someone my age? And could any of these be interacting with each other? Make sure you understand the purpose of each medication and what side effects to watch for. Don't be afraid to speak up if something doesn't feel right. You are your own best advocate. Beyond medication management, There are powerful lifestyle habits that can support your heart health, especially as you age. Regular physical activity is not negotiable. Aim for at least 150 minutes of moderate-intensity exercise, like brisk walking, per week. Even small amounts of movement throughout the day can make a big difference. Your diet is just as important. Focus on a heart-healthy eating pattern rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limiting your intake of sodium, saturated fats, and added sugars can have a huge positive impact on your blood pressure and overall heart function. Managing stress is also key. Chronic stress can raise your blood pressure and heart rate. Find healthy ways to relax and distress, whether it's through meditation, yoga, spending time in nature, or enjoying a hobby you love. And finally, if you smoke, quitting is the single best thing you can do for your heart. It's never too late to quit. So, let's recap how to protect your heart as you age. First, be an active participant in your healthcare. Understand your medications and review them regularly with your doctor. Second, know the warning signs of a potential heart problem and seek help immediately if you experience them. Third, embrace a heart-healthy lifestyle through diet, exercise, and stress management. Living a long, healthy, and independent life is the goal. And being smart about how medications interact with your aging body is a huge part of achieving that. Your heart has been working hard for you for decades. Now it's time to give it the extra care and attention it deserves. Thank you so much for watching. We hope this information empowers you to have more informed conversations with your healthcare provider. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. Don't forget to subscribe for more tips on healthy aging. Stay safe and take care.